Welcome to Noble Theory Podcast. Today we're talking about healthcare. Should we have a right to healthcare in the United States? Is healthcare a human right? We're going to discuss these issues and we're going to listen to some top people who have talked about this at length. Scott, what are your initial thoughts?
When you say top people, Jeff, I'm thinking Bernie Sanders and AOC and right?
AOC.
Those would be the top people pushing for this. Healthcare is a human right. I don't know, from where I'm sitting, it's a bit of a crazy concept. I don't think it is a human right, and I may be wrong, and I may be chastised for that. But let's get into this, Jeff, and figure out what does that mean, and let's unpack that.
We'll do it. Let's hear what Bernie Sanders and Jon Stewart have to say.
If you're triaging the patient of America, what's the first thing you want to address?
I've always been deeply concerned about healthcare as a human right.
Right.
And this is something that is so doable. We are the odd guy out as a country. I live 50 miles away from Canada. You spend a month in a hospital in Canada. You know what the bill is when you come out? Zero. They spend half as much per capita as we do on healthcare. They guarantee healthcare to all of their people. This can be done.
Okay, so this can be done. What do you think about that, Scott?
Well, I grew up less than 50 miles from Canada in Detroit. And from where I was and where I still am, a little bit of a distance from Detroit, the Canadian healthcare system really doesn't work. There was a lot of people trying to come from Canada and its more proximity from Windsor into the States, trying to get bypass surgery and cancer treatment and life-threatening conditions that people didn't have access to because of the backlog, because of the bureaucracy, because of the waiting lists in a much smaller country running a much smaller healthcare system, Canada.
Yeah. So Canada is just one of many countries. A large number of European countries have some sort of a public healthcare, whether it's just the financing of healthcare or if it's the provision of healthcare services themselves. And that's an important distinction that we really have to unpack a little bit, because healthcare can be provided by the government, but financed privately. It can be provided by private industry and financed privately. It can be publicly financed and the provision of it could be private, or it could be both private provisioning, or rather public provisioning, and public financing of it. And usually public finance entails having some sort of a tax base that draws the money into the government to pay for it.
Listen, Jeff, just one of those things, those bullet points you just laid out, those different configurations. I'm sorry, but the U.S. government struggles to run large bureaucratic, administrative heavy organizations or implement those kinds of things. Now, there are a few exceptions, but unfortunately, if you look at the way the government has run things in the past, they don't have a good track record, and there's tons of abuse and cost overruns and pricing's out of control, and the bureaucracy and the wait and the inefficiencies in big government are well documented, and this is people's health. So this is more important.
That's true, and bureaucracy can have some impact, but I think the topic that Bernie and we'll see in just a moment AOC are most concerned with, one that they're struggling with, is: do we have a right? Do we have some sort of a natural right, or do we have some sort of a claim, a right to healthcare? And so let's turn to another video here, and we will.
Well, just the big question right there quickly is who pays for it, right? How does that happen? How is this right bequeathed upon people?
Stand with the working class. For example, healthcare is a human right, not a privilege.
Okay, human right, not a privilege. So, human right. So a human right. We would all, if we could construct a form of government that allowed for everyone to have human rights satisfied, I think everybody would be fine with that. The problem is that your human right to one thing that the way they're articulating it is somebody else's duty or burden that they have to then provide, right?
Obligation and some sort of
An obligation. So if there was a great debate in the 70s, 60s and 70s between two Harvard philosophers, John Rawls and Robert Nozick, and they debated this idea of do you have entitlements to public goods, essentially, and John Rawls had this wonderful device. It's a sort of a thought experiment. You're about to enter the world. You're outside the world. You don't know if you're a male or female. You don't know what your race is. You don't know your height, weight. You don't know anything at all about yourself. You're just sort of this cosmic dust. But when you enter the world, at that point, you will take some form. And when if before you make that transition into the world, you were to construct a set of laws that would govern you, what would those laws be? Would you have any laws that restricted people based on race or based on gender? Of course not. So we don't know our health profile. We don't know what. We would like to have some access to healthcare. The problem is that unlike creating a set of laws, which is what John Rawls sort of envisioned when he came up with this notion, this cognitive exercise. This is not his items were, we don't know if we're male or female. We don't know if we're gay or straight. We don't know if we're black or white. None of those conditions place burdens on others. That is, having a race-neutral set of laws is good. That's a good thing because nobody has any control over their race, their height, their eye color, and so forth. And since these are immutable characteristics, these immutable characteristics can't be changed, and you would not want to construct a set of laws that penalized some people based on immutable characteristics. Healthcare is not an immutable characteristic. Yes, it is something we all need, but others have to provide it for us. So if we create a right to healthcare, a human right to healthcare, that means there has to be a human duty, an obligation for somebody else to provide that healthcare. This is the problem when you get into provisioning goods and services rather than trying to make a sort of a set of laws that are neutral to immutable characteristics.
Well, and if you extrapolate forward, Jeff, to your point, I mean, to me, healthcare itself, if you had healthcare as a right, that feels like just the extension of that is the government running the program, a single healthcare provider. And this offers all kinds of, there's probably a compromise in the care. There's going to be, with more patients relying on a single system, the healthcare providers can be overwhelmed. They can longer wait times, lower standards. I mean, all kinds of things can come out of a government-run single-payer health system, not to mention the bureaucracy and the waste and the cost. Someone has to pay for all this. Now,
yeah, but somebody has to not just pay for it, right? So a government could construct a situation where they forced certain people to undergo medical training, and then they forced those people to work in certain occupations in the medical industry, right? Nurses, physicians, lab techs, and so forth. You may scoff at that and say, well, that's absurd, but that's precisely what has been done in China and in under communist control, and in the Soviet Union and other nations who have attempted socialism and communism. They've told people what they were going to do, right? And so this is not something that's too crazy or too far remote from our historical knowledge to even go back to examine how that actually worked out.
Which is a nice transition into, I'm not sure if it's our next clip or not, we should look at who has national health care and to what level and to what efficiencies.
Yeah, sure. Let's take a look at exactly that. So this is a search for list of nations with constitutional right to health care. These are all nations that have had, in modern history, constitutional rights to health care. And we have Uruguay, we have Latvia, Senegal, South Africa, Brazil, Tunisia, Burkina Faso, Portugal, Mexico. All right, so, and Algeria. So among those nations, we're not seeing, too many, examples of where we've got a great deal of freedom, of liberty.
Well, what about economic fortitude as well, right?
These are not countries with strong GDPs. In fact, if you were to dig into each of these nations, you'd see that while they have a constitutional guarantee to healthcare, very few people have access to much healthcare because there's just not enough money to spread around the population to provide them with adequate healthcare. So healthcare tends to be pretty poor in these nations. In addition, you strip liberties, and notice these are liberty stripping nations, not entirely, but they are not known as champions of universal liberty. So going back to our previous point just a moment ago, when you provide a right, there's an attendant duty to provide for that right. There's also a stripping of liberty and freedom. And so if you value, like John Rawls talked about, before you enter the earth, you want to construct a set of laws that provides equal treatment. Yes, under the law, you want to provide freedom. You want to provide liberty. That's how a country becomes a strong country and a very powerful country.
Getting into some of the things about of the marketplace and competition, and which is a different set of problems.
Well, but liberty in that we get to choose what kind of a life we want to construct. We're not assigned doctor or nurse. Right, when we're graduating high school or trade school, 16 years old, the government tells you you're becoming a nurse, you're becoming a doctor. That's not liberty enhancing. That's stripping of liberty. Sure. And when you have a system to allocate medical provisions across a population, this form of distributive justice oftentimes entails the stripping of liberty, the forcing of people into almost a kind of a slave-like situation where you have to do what the government tells you to do. And this is something that you just research the history on the former Soviet Union, and you'll see that people were assigned occupations. This is not a crazy concept. And so the moment you start assigning human rights to material goods and services, you have to then impose, by the way, this is by pain of death, by penalty of death, what you have to then do to provide that duty. And it could be in the United States, you don't get assigned occupation, but it may have to come to that. But you would also have the situation where people were being taxed more heavily to pay for this. And when you tax someone,
you invariably would have that, because
when you tax someone, you're taking liberties away from them. You're restricting their liberties because now they can't do what they think is best, what they choose to do with their money.
Sure. And look, I mean, this is happening in China. They're selecting grade school kids. You're going to be an Olympic gymnast. You're on the gymnast team, and we have chosen you to pursue gymnastics to represent the country of China, and that's what you do. And so obviously there are places in other parts of the world. I'm sure North Korea has the same thing. You're given a task as a government employee, and that is your lone task to accomplish every day, each day, regardless of your own pursuit.
Hey, Scott, let's take a look at what some top economists have to say. This is David Cutler at Harvard University about the nations with the top healthcare systems.
You mean in how to pay for it?
No, just the top. What are the top healthcare systems?
Answer might not be applicable. If you look at the World Health Rankings, the country that came out on top is France. I think in general, starting from France and working northern, you tend to get the best healthcare system.
What David Cutler just said was that the top systems were not any of the nations on that list that guarantee a human right to health care. Nowhere close on that list. These are wealthy, largely wealthy European and North American countries.
Members of the G7, so to speak.
Members of the G7. And so they're able to, and by the way, these are not nations that have constitutional rights. These whatever, healthcare, public healthcare they're providing could be stripped away at any time the government chooses to do that. This is not a constitutional right. Again, liberty is the trade-off for the government provisioning of healthcare, that so-called human right to healthcare. By the way, there are all kinds of human rights that we could examine. And for instance, isn't the right to food even more primary than the right to healthcare?
Interesting. Yeah.
But nobody's talking about you have a human right to food. Nobody's sort of expounding the benefits of the government provision of food. Again, this is going back to Soviet Union. This was tried and it didn't work so well. The farmers refused to do much work because there was no benefit to them for doing it.
Well, remember too, though, the media hounds like Bernie and AOC, this is this big, very emotional talking point that they get to talking about healthcare, and healthcare for undocumented and that whole mess. So that's big part of their thing is that this is what gets the public's attention. Your point's better. You're right. It's a much more, germane to survival, would be food, because you won't need any healthcare if you can't eat.
Let's take a look and listen to what AOC has to say in our last few minutes here.
Politics out of what should be a guaranteed universal right in the United States of America, and that is health care. And so I will not accept
She thinks there should be a guaranteed right to health care. But how do you square a right, a duty to provide for that right that she wants to guarantee with individual liberty? How do you square the payment, the cost, or the educational burden the attendant burden that must come along with that? I'm not sure how it would be done, and I don't know that it would produce the best system. It seems to me that the best way to provision healthcare is to get government out of healthcare. Part of the reason that healthcare is so poorly provisioned in the United States is that healthcare entities are tied together with government, and special interests benefit, and the people who need the healthcare do not benefit from that very much.
Well, it's not even the government and the whole healthcare behemoth. They're not just working together. They're in essence one. Let's face it. I mean, at this point in time, based on oversight and regulation and administration of healthcare policies and procedures in this country, the government's running the healthcare system, or trying.
Very much so. The Medicare, prior to Medicare and Medicaid systems that were created in the 1960s, most people, when they saw a doctor, they were paying it from their own. They're paying for that visit through their own personal financing. They either had private insurance. And some people didn't have even insurance, and they would just write a check and pay for that out of pocket. Now maybe you can make the case that healthcare wasn't as good back then. That may be the case, but at the time, the American Medical Association fought the creation of Medicare and Medicaid because they thought it was going to do harm to physicians by stripping liberty from physicians.
Funny, right?
They lobbied very well after the creation of Medicare and Medicaid in the 1960s. And now if you look at what a doctor earns relative to the average salary, they earn something like 4 or 5 times what the average salary is in the nation right now. If you go back prior to Medicare, Medicaid, they only earned about twice what the average person earned, and so there's been a huge transfer of wealth from consumers of healthcare to physicians through the government enterprise of Medicare and Medicaid. They're setting all the prices.
If you look at those as business models, they're much smaller groups, right? Medicare, Medicaid, the two groups, predominantly the two groups that those two forms of healthcare are addressing are a tiny fraction of the whole country. And look at the abuse, look at the inefficiencies, look at the problems, look at the out of cost, look at the waits, look at all the, candidly, many physicians, many healthcare organizations don't want to treat Medicaid patients because there's no money in it, and this becomes this is all part of this.
That's the claim. I would suggest, hey, look, I don't really. I mean, if you want to press me on this, Bernie Sanders says a lot about the economy that, as it turns out, the conclusions might be true. The way he gets there, the reasons that he cites are wrong. The outcome is probably right, and he talks a lot about oligarchies and about the sort of the very wealthy elites controlling the economy. That's
one
correct.
Of which
but they control it. They control it through government. They control it through him because he's a senator who makes laws that benefits those wealthy oligarchs, that benefits the wealthy elites. See, it's the legislators who are creating the subsidies, the special benefits, the regulations that benefit these people, particularly the healthcare industry.
That was a really smart way of saying that his book is an autobiography, Jeff. I think that's very there's some truth to that, right?
That's true. I don't own 3 houses.
No. Yeah, and he does.
He does,
as he's professing that that it's all about the common working man and the struggles of the blue collar. Working class.
So we would love to hear what you have to say yourself about this topic. So do you think Bernie Sanders is right? Do you think AOC is right? And if you do say they're right, why are they right? Please comment below and let us know your thoughts.
Don't forget to like and subscribe.